it's very good to be here, and at a really interesting time, obviously, with the election approaching, with austerity reaching further and further into our public services, and all kinds of reconfigurations of public services happening, and of course the big decision next year about the future of Trident, and all of those things come together, I think, really well into a conversation about how public money is used, and whether or not public money is used in the public interest. And of course I would want to say, as I know you all would, that the £3 billion already spent on just exploring the renewal of Trident is wasted money, and certainly the £100 billion it would cost over its lifetime is money that we cannot afford to see spent on a weapon that nobody needs, and a weapon we want well and truly wrapped up. So we don't want that weapon of mass destruction, and we don't want the other weapon of mass destruction, i.e. the coalition government. It's whoever else we want in its place. I think none of us would want them, which is waging its own war on the people of the UK, and particularly local government. And I hope I don't bore you to death with figures and bore you to death with local government, but I think it's really important to talk about it, because actually much of the opposition to austerity has been about the NHS, which of course is absolutely right. Health is central to everybody's lives, but without local government, other public services can't work. And we've seen that the interaction between social care and health is a really critical one. The same is true of education, good housing, and all the other things that local authorities do. And I'm afraid that that weapon of mass destruction in Westminster has waged terrible war on local government. And in UNISON, in my team, we're in the process of finalising what we're calling an audit of austerity. So we've been looking in detail at what's happened since 2010 to local government spending. So, so far the coalition's cut about £30 billion from public expenditure, but almost £13 billion of that, getting on for a half, has been taken from local government, with really terrible consequences. So on average, council budgets have been cut by 40%, but the greater need there is within a local authority, the higher the cuts have been. So if you're a Labour council in the north, or even bits of the Midlands, you will have faced much more severe cuts than Surrey, Windsor and Maidenhead, Wokingham and Bracknell in the affluent southeast. So there's a very definite political bias in the way the cuts have gone. 500,000 jobs have gone from local authorities. No one's much talking about that. It's been well hidden, and indeed central government jobs have slightly increased in that period. And more broadly, we have, 40% of families with children living on less than the living wage. We all know that inequality has grown, and the gap between the rich and the poor has widened. Local government workers have lost 20% of their earnings in real terms since 2010, and that's without taking into account the way that holiday pay, sick pay, maternity leave and everything else has been attacked. So for the first time last year, the bottom rate of local government pay would have fallen below the national minimum wage, not the living wage, the legal floor below which wages are not meant to fall. And the local authority employers had to rush round sending out things to local authorities to say, raise the bottom rate, because otherwise you'll be breaking the law. So that's, probably as bad as it gets. So let me just tell you a bit about what our austerity audit has found, and why we need all that money that is going otherwise to be put into Trident, to be put into local government and the NHS and everything else. So almost 500 libraries have closed. And another 400 libraries are now dependent on volunteers to run. And there are lots of problems associated with that, not least child protection. 578 children's centres, 300 and more youth centres, 361 police stations, 33 fire stations, hundreds and hundreds of public toilets, which is a big issue for the public as well as public service workers working outside, and about a quarter of street lights across England anyway are now turned off at night. So, you know, really, really bad stuff. So that 3 billion that's already been spent and the 100 billion that will be spent certainly needs to be diverted. I want to say something particularly though about social care, because everyone here I know will be aware that there is a huge crisis in social care, particularly domiciliary care, care in the home, but not only care in the home, and that has a huge knock-on effect onto the NHS because of bed blocking and all kinds of other things. But let me just tell you a bit about what's happened from our austerity audit. Last year, 10% of elderly people received local authority domiciliary care, compared to 15% in 2005. So in a short space of time, the amount of care that's provided has fallen, and 32% fewer people have received care now than did at the beginning. There's been an almost 20% cut in funding of home care since 2010. And 85% of councils are now only providing care to people with deemed to have substantial or critical need. So, not like in the old days when some people just needed a bit of support, bit of shopping, bit of cleaning, a chat with someone. That's gone completely from local authority provision now. And of course on top of this, and I think this is another weapon of stealth, the privatisation weapon if you like, the other thing that's happened is that 97% of home care is now in the private or voluntary sectors. And a substantial portion of it is now provided by 6 providers, 4 of whom are owned by hedge funds, and who have quite diverse interests and activities, and who determine the market, really, and who certainly determine paying conditions. So there are now almost 250,000 home care workers who are paid less than the national minimum wage. How can that be, you say? Because the national minimum wage is a legal minimum. Well, they're paid less than £250,000 because they are not paid for travel between visits. HMRC, who oversees the national minimum wage, deems that to be working time, quite rightly. But of course, if they're not paid for travel time and you average their payout, it takes it well below the national minimum wage. And in UNISON, we've developed an ethical care charter, which we're trying to get councils to adopt to tackle this problem. But of course, at the heart of it, again, are the cuts. Because what's happened is the funding from local authorities to the providers has been cut, and some providers are now being paid less for the same service than they were in 2010. The consequence being that some of them are now commissioning 5-minute visits, but the 15-minute visit has become the norm. And please tell me, anyone here, if you can get yourself up, get yourself dressed, washed, dressed, breakfasted and out of the house in 15 minutes. I can't do it. and you certainly can't do it as a home carer with an elderly or disabled person who has to be perhaps lifted, helped downstairs, upstairs, whatever. It's impossible. So there really is a crisis in domiciliary care, but there's also a crisis in other areas of social care, residential care, where the number of local authority homes left is now incredibly small, increasingly run by the private sector, and with disastrous consequences in some cases when profit margins aren't enough, when companies are taken over, new owners come in, things collapse, the local authority has to pick up the pieces. Very difficult. And all those support services that I think we all used to take for granted, like Meals on Wheels and daycare centres, have all been cut too. So there's been a 65% drop in the number of Meals on Wheels provided since 2010. There are some local authorities who have really a skeleton service. And in daycare centres there are 2/3 fewer places than there were in 2010. So this is really dramatic stuff. And it's very difficult to get it across quite often because local authorities are not sexy. There's still a kind of view out there that they're full of overpaid pen pushers, you know, sitting in the town hall, wasting time on big fat pensions and so on. Absolutely not the case. Everybody here I know will appreciate the range of services that local government provides. And had this scale of cuts happened in any other public service, particularly the NHS, then everyone will be up in arms. And we're trying to do our best to bring it to public attention. So really, you know, I just want to reiterate that we need to push as hard as we can in the run-up to the election, but obviously in the run-up to the review of the NPT next year and so on, to build a coalition to build public support against Trident. We know that 75% of Labour MPs are against the renewal of Trident, and there are some small signs, aren't there, that perhaps Labour and the Lib Dems are having a bit of a rethink. The Greens, to their credit, Plaid Cymru and the SNP too, opposed to the renewal of Trident. So we do have an opportunity, and I think we should take it, but I think we need to muster all this information and all these arguments about what's happened to public services as part of our alternative arguments, because public money should be, as the word says, money spent on the people, not money spent on killing people. So hopefully we can use this moment by using the arguments about the NHS and all of our public services, the whole of our public sphere, to make a dent in the argument for Trident.
Thanks very much, Heather. It's really good to have that cost really itemised. And we all recognise it's not just an economic question in a narrow sense. It's a question about ethical priorities, isn't it? Where do you spend the money? It's often said this is an economic question only. And by stressing it, CND is not taking on account the ethical issues. But actually it's an ethical issue. An ethical issue of how you distribute resources. It's a basic question about equality and social use, isn't it? Anyway, thanks so much.